Beta-adrenergic blockers inhibit response through beta receptor. Now first we recall the action of beta-adrenergic drug, which have a increasing heart rate, decreasing blood pressure, bronchodilation, relaxation effect and no effect on iris. Now classification of these beta blockers, which have a non-selective and the cardioselective. Non-selective included three types of without intrinsic sympathomimetic activity, which include propranolol, sotalol and timolol, and with intrinsic sympathomimetic activity includes pindolol and with alpha blocking property called labetalol. And then cardioselective includes atenolol, betaxolol, celiprolol, esmolol and metoprolol. Now we read the actions of the propranolol are follow as: first, action on the CVS heart, decrease heart rate, force of contraction and cardiac output, prolong systole by retarding contraction, cardiac void and oxygen consumption reduced, total coronary flow reduced, abbreviated refractory period, AV conduction slowed, block cardiac stimulant action, overall effect in angina, improvement of oxygen supply, exercise tolerance increased. Now the action on the blood vessel, no direct effect on blood vessel. And then the respiratory tract, increased bronchial resistance by blocking dilator beta-2 receptors. Effects are highly visible in normal individual because sympathetic bronchodilator tone is minimal. In asthmatics, however, condition is consistently worsened and severe attack may be precipitated. Now the action on the CNS, no overt central effect produced. In long-term use of these beta blockers, subtle behavioral changes, forgetfulness or dreaming increases is seen. Also, propranolol suppresses anxiety in short-term stressful situation. Local anesthetic, membrane stabilizing sodium channel blocking property, potent local anesthetic, not clinically usable local anesthetic due to irritant action. Metabolic, increased polyunsaturated free fatty acid level, plasma triglyceride and LDL increase, glycogenolysis attenuated. Now the action on the uterus, relaxation blocked. 7th, and on the eyes, decrease aqueous secretion. Now the adverse effect and contraindication of this beta blocker. Well, beta blocker are well tolerable drug, but akin to it, myocardial insufficiency can precipitate CHF edema by blocking sympathetic support to heart. Bradycardia may reduce to less than 60 mm Hg or less. Worsen chronic obstruction lung disease can precipitate asthma, exacerbate variant angina due to unopposed mediate coronary constriction. Uses of these beta blocker. In the hypertension, beta blocker, mild hypertensive, one of first choice drug. In angina, all beta blockers are benefit, decreasing frequency of attacks and increasing exercise tolerance. High dose पे वर्सन हो जाता है angina, cardiac arrhythmia, mainly propranolol, suppress extrasystole and tachycardia. Fourth, MI, mainly propranolol and metoprolol have been used for two purposes. A. Secondary prophylaxis of MI, and second, myocardial salvage during evolution of MI. CHF, however, beta blocker acutely worsen heart failure, but some have beneficial hemodynamic effects. Is glaucoma, ocular beta blockers can widely used for wide-angle glaucoma. Like beta blockers used to treat cardiovascular disease, hypertension, angina, arrhythmia, MI, eye disease, glaucoma, and not to use in respiratory disease like asthma and COPD.